Hello, it's Dr. Jack Krasuski, and I'm here to tell you about the MOC requirements. This is just the number one category of questions that I have emails sent to me and when I'm at live courses that doctors talk to me about. And we have a lot of calls coming into our call center about this. So I hope that I can clear up some areas of lack of clarity. And also, after I present the MOC requirements, I'll tell you about the different products, educational products that here at American Physician Institute we have that can help you meet your requirements if you're interested. This is our lecture agenda, and let me first start off with a big picture view. So I look at the MOC or certification really as having gone through three ages. So the initial age was the age of certification. So before 1994, a physician who certified with ABPN would achieve a lifetime certification. You had to take a Part 1 and a Part 2 exam. If you passed, you were set for the rest of your life. Starting in 1994, we entered in the age of recertification. So you had to have an initial certification, and then every 10 years you had to have a recertification exam. And now we're in the age of maintenance of certification, and you'll notice that nothing is ever taken away, only more things are added. And so not only do you have to get your initial certification and take your MOC or recertification exam every 10 years, you also have additional requirements in between time. In particular, meeting Category 1 CME requirements, self-assessment credit requirements, and performance and practice unit or units. So this is the revised ABPN MOC requirements. If your exam, your MOC exam is any time between now and 2021. Now, these requirements were revised earlier in 2014. And the reason is because the ABPN realized that they had kind of unfairly put on these requirements that really take 10 years to complete, but they really roll them out to physicians who did not have 10 years to complete them. So, for instance, my next MOC exam is in 2017, and I only learned about these requirements in, I think, 2011, sometime around there. So I was already several years behind meeting my requirements. So there was kind of a backlash and stress and doctors not really being able to meet them. So the ABPN, I think, wisely rolled them back. So anyway, these are the current requirements. Number one, you have to earn, if your exam is in 2015, 270 Category 1 CME credits. Now, this is not too challenging. Again, this is over 10 years, so it really averages out really, it should be 30 a year. They're just kind of giving you 9 years worth. So, most of us get, 30 or more hours of Category 1 CME. So this is not too challenging. And then starting with the 2016 exam through 2021, the exams then, you need 330 per year times the 10 years. We normally meet these requirements anyway, so not too much of a challenge. However, the next two are something that is unique. So we need to earn 24 self-assessment credits over this 10-year period, or whatever, until between whenever you start and the time of your exam, or to be more specific, until the time you register for your exam. And this is a significant rollback. Depending on the phase-in schedule, depending on your year, you may have had to meet, either 48 or 72 self-assessment credits. Now, everyone through 2021 only needs to meet 24 self-assessment credits, and I'll talk about them in more detail as we go through this. And now we only have to complete one performance and practice unit. Again, depending on the phase-in, some physicians would have had to do more than one PIP unit. And then once you have completed all three, then you become eligible to register for your MOC exam. You're asked to attest that number 1, 2, and 3 are completed. Now, what does it mean to attest? Meaning, like on word of honor, you're saying that you completed these. And then the ABPN will audit a certain percentage of of the doctors who register for the exam to ensure that they really did complete these requirements. They will ask you to send in a documentation of having done this. Now, in 2022, the MOC requirements are different. They become, or slightly different. They become called continuous MOC requirements. And at that point, you have to earn 270 CME credits over 10 years. It's 30 credits for each of the first 9 years. The 10th year, you get a respite from all the other requirements other than taking your exam. So you got 9 years of kind of activities, and then the 10th year, you take your exam. You also then have to earn 72 self-assessment credits within the 10-year cycle, 8 credits for each of the first 9 years, and then complete 1 PIP unit every 3 years, 3 units total over 10 years. And what the continuous MOC requirements mean also additionally is that you're kind of kept on a short leash. Until 2021, it's sort of like anytime you can get them done before you register for the exam, you're okay. Starting with the doctors who took the 2012 exam and are now going to have the next one for 2022, they are now in this program, this continuous program that enforces having to, in a more regimented way, meet these requirements in each kind of time unit. And the same thing, you will then attest that you were completed 1, 2, and 3 so you could take your exam. This is a table that kind of describes exactly what I have been described. It's the new reduced phase-in schedule. And you'll notice for 2015, you need a total of 270 CME credits. For those next years through 2021 will be 300, and then it drops back down to 270. Again, 30 per year for the first 9 years. Okay. Now, more information about MOC requirements. So if you're double boarded, you only need to complete 1 set of MOC requirements. And this is true if you're boarded in your specialty, let's say psychiatry, and a subspecialty, geriatric psychiatry or child adolescent psychiatry. You only have to do 1 set of MOC requirements. However, even if you're boarded in different specialties, so for instance, maybe you're boarded in general pediatrics and also in child adolescent psychiatry, or internal medicine and then general psychiatry, then you only need to complete 1 set of MOC requirements. Since the exams are given by different boards, you will have to kind of fill in the details on each board website on your kind of dashboard, your portfolio site, that you have completed these requirements, but you only need to complete 1 set. Now, when you have more than 1 board exam coming up, and you have more than you have to complete these MOC requirements, you have to get them done before the first exam, because for the first exam you're attesting that you have it done, so you have to get it done for the first exam, and then for the second exam, yes, you can then obviously attest to it because you already have had it done earlier. Now, another thing that comes up for lifetime certificate holders, so the doctors who achieved lifetime certification before 1994, it's optional to enter in the MOC pathway. And sometimes doctors will choose to do this for career reasons, like maybe your position at your work, your employer wants to see this, is encouraging you, or maybe there's some financial incentive. They'll give you a bonus or something like that. Or some doctors do it because they just feel that they want to keep up with the current knowledge base, so they will voluntarily enter in the MOC pathway. However, you must know that if you do that, then you're kind of committed to that pathway. You can't just, let's say, take your MOC exam and fail and then say, well, never mind, I just gave it a shot, but, I have a lifetime certification. Well, not if you actually apply for a certification exam. Then you are required to then have your recertification exam every 10 years, and then you're required to meet these MOC requirements too. Now, what happens if your certification expires, whether because you missed the deadline for the exam or you forgot about it, or maybe you took an exam and failed it, although that's very uncommon situation. In any case, if it expires, as soon as you take and pass your next exam, again, with the prerequisites of meeting your MOC requirements, your certification will be reinstated. And then another point of interest is that when you take the MOC exam, just taking the exam earns you 60 AMA Category 1 CME credits. So it's going to be the beginning of your next 10-year phase, because when you're applying for your exam, you're already attesting that you've met all your CME requirements, and then you take it the following year, right, your 10th year, and then when you take it, you earn 60 CME credits, so it'll be for the first year and actually good for the first and second year of that next cycle. So that's the long and short of the MOC requirements. Now, let me tell you about how American Physician Institute can help you meet all these requirements. So we have what we call the 100% MOC solution, where we combine two products, the CME to Go audio lecture series together with Simple PIP. So the CME to Go audio lecture series, if you get this 3-year package, you will earn 120 CME credits, 40 credits each year, and out of those 120 CME credits, 24 are also approved by the ABPN for as self-assessment credits, and that will be 8 credits each year for the 3 years of this 3-year subscription. And then when you get this 3-year package, we will throw in Simple PIP, and I'll tell you how that works in a moment. Kind of, it's just included without additional cost. And all of our self-assessment products are we apply for and are approved by the APBN for the self-assessment credits. So this is our special offer, getting the 3 years of the CME to Go modules. CME to Go comes both as a physical product. That's a little bit more expensive. And then if you only want the MP3 versions without getting all these CDs sent to you, it's less expensive. So if you got the physical product, this is the way it would look like. Let's say you wanted the 2014 modules because you still wanted to kind of catch up on things, 2015 and 16. 4 times a year we would send you this package of 8 CDs that you would plop into your car stereo or burn them onto your computer or what have you, and you would listen to them. The first 2 CDs of each module are approved for the self-assessment credit. So, and then we also throw in this, again, what we call the Simple PIP. Now, the Simple PIP really requires you to complete an assessment, a self-assessment, come up with a plan for improvement, and then reassess yourself. Those are the 3 steps of what it means to do a performance and practice unit. And because of the nature of what you have to do, we can't kind of go there and do it for you. But what we can do is really simplify it dramatically so that you can do it without kind of no fuss, no muss. And I estimate that if you sit down and do this, the requirements for your performance and practice unit, again, if your exam is anytime between now and 2021, you do 1 unit, you're set. But it'll take you around 4 hours of actual effort. So 4 hours is kind of a lot of time, but if you think about it, then you're done for your exam, then it's not so bad. Now the performance and practice unit is made up of 2 different modules. There's the feedback module and the clinical module. Now in the feedback module, the ABPN wants you to survey 5 patients or 5 peers. And by the way, this is also revised down. Previously, you had to survey 5 patients and 5 peers. Now it's an or. And this is very important because a lot of physicians, a lot of psychiatrists don't have really 5 peers they could turn to. They work in a very small clinic or by themselves in a small town or rural area. So I think that's a nice improvement. So you survey 5 patients or peers. You give them a questionnaire. If you get the Simple PIP, you get a questionnaire. You just hand it out to people. You ask them to answer questions. And then the step 2 is your plan for improvement. You read the reviews and you see what information you can extract. Like, is there any pattern to what you're seeing? So let me give you an example. Let's say, I survey 5 patients and I see a pattern that people are saying like, hey, Dr. Jack, I like you, but you don't give enough information about medications that you prescribe. So then maybe my improvement plan is to hand out, informational sheets every time I start a patient on a medication. And then I reassess myself, and by giving 5 new patients, a survey, and then lo and behold, I find out people are no longer complaining about kind of like the shortage of information about medications. And I want to point out an important thing. The ABPN requires that you assess and reassess yourself within a 24-month period. And I find that a lot of physicians kind of misinterpret, and they think they have to wait the 24 months or 2 years after the initial assessment to then reassess themselves. That is not true. You have up to 24 months, or you have to do it within the 24 months, right? So what is the shortest period of time that you can assess, improve, and then reassess yourself? And the answer is you have to give your patients enough time to notice that you've made some changes in the way you practice. For instance, like now I'm handing out these info sheets. I need the patients to actually experience this new way, my new way of practicing. So realistically, I think, after you make this change in whatever way, you have to give it maybe a month or 6 weeks, and then the patients that have experienced this change, this improvement that you've implemented, give them a new survey and see now if they've noticed and if they no longer have the same type of complaints. All right. The clinical module, you review 5 patient charts. You kind of notice whatever kind of shortcomings you might notice, like, gosh, I'm not getting labs consistently. Look at my patients on lithium. I haven't gotten a TSH here in 2 years. I should be getting this every year, and elderly patients maybe every 6 months, right? So again, I come up with an improvement plan and then reassess myself at some other later period. So the Simple PIP is an online kind of a structuring tool that gives you all the components to kind of get through this process without it causing you headaches. And it's all online. It looks like this. So this is how the Simple PIP would look on an iPad. It's basically you see these tiles, assess, improve, reassess. You just hit the tile. For instance, a survey form comes up. You just print it out, you hand it out to 5 people or, peers or patients, right? And then the improve, there's a couple lectures you can watch, ideas for improving, sheets on what your plan will be, and then some further sheets on how to reassess yourself. And then I think an important thing is then we also have evidence that you've completed it. There's like a checkbox there, signify that you have this completed. From your end, what I would recommend, whether you use the Simple PIP or not, when you take those survey forms, put them in the manila folder, put it in some drawer at the bottom of your desk somewhere, and just write down, MOC requirements or PIP, write down the year, and that's probably all you need. If you're ever audited, you can pull that out. We can also, from our end, send evidence that you've completed this unit. So our special offer is if you get the 100% MOC solution, the 3 years of See Me to Go, and then the Simple PIP, then you can have all of that for $9.97 if you want the CD versions like that slide I showed you with all of those modules sent to you. Or if you don't want the physical product because you just want to upload the MP3s right onto your smartphone or something, then it's only $7.97. And that's for the full 3 years, right? 120 total CME credits. That includes 24 self-assessment credits, and then the Simple PIP is thrown in there. So it's really a very good offer. And I'll talk to you in a second, or not a second, but in a couple minutes about the Master Psychopharmacology Conference we have coming up. And if you get it before the end of the year, we have an additional kind of combined discount. I don't want to spend a lot of time on this slide, but this is just to highlight for you that if you're behind on your self-assessment credits, we have other additional educational products that we have received a ABPN approval for self-assessment. And you can just give us a call or look under masterpsych.com for more information. Now I'm switching colors and brands and talking about our 6th annual or 2015 Master Psychopharmacology conferences. I'm really excited about these. These are conferences that I really get excited about, but I'm particularly excited for 2015 because we're doing two things that are really unusual. The first of all, we're giving away a car. So anyone who attends the conference, we're going to have a raffle drawing, and someone's going to win a 2015 Fiat. And you can go to the website to see it and get more information about it. Our spring Master Psychopharmacology conference is at the Disney's Boardwalk Inn in Disney World Resort in Orlando, Florida. You see the dates there, the 5th through the 8th. And here's more information. There's a pre-conference day. Our topic for this year's our one-day fellowship is in addiction and pain medicine. Our core conference is the 3 days is blazing answers to burning questions. So it's a new editorial strategy that I'm really excited about because our conferences are very practical, but to make them even more practical, we basically almost disallow lecturing. It's sort of like we start off with the burning questions that clinicians have. They've sent to us. We've gotten like hundreds of like these burning questions, the most kind of challenging clinical situations and conundrums. And then we force our faculty to actually answer and respond to how they would handle it. I'm just sick and tired of lectures where people are talking about like studies and, on and on, Schwartz et al., the p-values, the n, and this and that, number needed to treat, and you're like, okay, but what do I do in my office? How does this relate to what I have to do, the decisions I have to make, the medications I have to use, the choices I make? So this is like giving our faculty no leeway to not answer practical, challenging day-to-day conundrums. I'm really excited about it, and I'll be one of the speakers too. I'm going to be talking about practice-related issues like legal issues and also borderline personality and suicide. So those are my topics. And so here's a super offer. So first of all, there's an early bird discount. So if you get the 6th annual Master Psychopharmacology conference, there's a $300 discount off the core conference as an early bird, and also $100 off the one-day fellowship when you combine it with the core conference. So the lowest price for this 4 days is going to be $697, a savings of a total of $400. But it even gets better that if you get the CME to go, the 3-year package with the simple PIP, we'll discount the combined tuition by another $200. Because, I really see those two products, CME to Go and our Master Psychopharmacology conferences, really working together. So it's sort of like it's a nice, complete educational package, very practical and very comprehensive, wide-ranging topics. And now, let me just more briefly highlight that we have also our 6th annual Fall Master Psychopharmacology conference. This one is going to be in California. So we have our Spring Florida Sunshine Conference and our Fall California conference. This one will be in Laguna Hills. It's in Orange County, just on a cliff overlooking the Pacific Ocean. You can walk down. There's a marina there at Dana Point. It's very, very nice. Our pre-conference day in the fall is a medical update for the psychiatrist, and we're going to have the core conference will be, just like in the spring, the blazing answers to burning questions. You may or may not know that we also have a child and adolescent version of the Master Psychopharmacology Conference. Usually we hold it in September. We held it in Washington, D.C. near DuPont Circle this last September. It was really great. So for 2015, if you have any advice for me or anything, any place, any faculty, any topics you want us to cover, please let me know. So we're, still have not finalized our agenda or our faculty list. Now, the benefits of these Master Psychopharmacology conferences, by the way, they're now all approved for self-assessment. So when you attend, not only do you earn CME credits, but you also earn the ABPN self-assessment credits. And they're very, very highly practical. They're in great locations. We have icebreaker receptions, and now we're going to be raffling off a car for the spring one. I'm excited to see how that goes. Very quickly, in passing, we also have an online course called Master the Changes in the DSM-5, if that's of interest to you. This is presented by Dr. Michael Furst, who, I'm not kidding, is the rock star of the DSM-5. I've learned so much from him about the DSM-5, so that's something for your consideration. And then note that we have a lot of Beat the Boards board preparation courses in psychiatry, geriatric psychiatry, and child and adolescent psychiatry. And I don't want to release it, let the cat out of the bag, but we're probably going to have the addiction psychiatry board prep course for 2015, so please stay tuned. I want you to know that American Physician Institute also holds a lot of other board preparation courses in many other medical specialties. You see here very broad range: anesthesiology, internal medicine, a lot of the subspecialties of internal medicine, emergency medicine, family medicine, general surgery, neurology, sleep medicine, pain medicine. It just goes on and on and on. So many, a couple dozen different specialties and subspecialties that we cover. So if you're interested in leaving me a message, record a message, it's 844-332-5453 if you want to record a message, or if you want to email me, just email me to Dr. Jack at AmericanPhysician.com. Dr. Jack, D-R-J-A-C-K, at AmericanPhysician.com. Thank you so much. All the best and a happy new year. Thank you so much. Take care now.